Senator Collins, Senator Murray.
Oh, thank you very much, Chair Cassidy. You know, we got to be real here. We are a month into open enrollment, a full month. The time to save people from these huge increases in costs they're going to see because the ACA tax credits expired was before these premium hikes were all but locked in. Saying, let's start talking about fixing this now, a month into open enrollment, instead of at any point earlier this year when we actually had time to stop premiums from skyrocketing or look at some of these different reforms. You know, this is about as serious as expressing concern about RFK Jr.'s anti-vax crusade after voting to make him the most powerful public health official in the country. The time is out. Realistically, the only way now we can stop people from seeing these huge increases is a clean extension and a longer open enrollment. And I think we should be honest about that. I appreciate, Mr. Chairman, the ideas being tossed around, even if I have some concerns with some of the proposals. But if Republicans had come to the table at any point earlier this year, there would be time to sit down and talk about this. But we have now seen the Republicans run out the clock. They blew right past the start of the open enrollment. Forget about time spent negotiating. Even if we passed this bill today, there is not time to implement anything more complicated than a clean extension. So if Republicans are serious about preventing the mega healthcare hike, they should work with us right now to pass a clean one-year extension as fast as possible, literally right now. And if their call for reforming tax credits is serious, we should look at that. We can talk about those reforms ahead of the 2027 year. But I have to say, I am not optimistic that most Republicans are serious about this because they refuse to talk about this problem before right now. And I've been down this road before. During the Trump administration, the first one, I sat across from Chair Alexander. We hammered out a bipartisan plan to lower costs. We were on the one-year yard line. And then a call came down from Trump and Republican leaders. They did not want us to get to a deal. They didn't want to help us lower healthcare costs, and they started demanding restrictions on abortion, something that had never been an issue before in our talks until then, and used that pretext to torpedo months of bipartisan negotiations. So excuse my skepticism today when we've seen this tired playbook. If Republicans want to talk about health care, Mr. Chairman, great. Unfortunately, we've heard many Republicans make it clear they're not serious. But if that changes, Mr. Chairman, I'm at the table. I am at the table. I'm ready to talk about our healthcare system in this country. So, Dr. Fegan, let me talk to you. Did any of the cuts Republicans made in their reconciliation bill this summer make healthcare more affordable for American families?
They did not.
Can you tell us why?
The reality is that when we we make people pay more for their deductibles, that they don't get care. The reality is when we say we're going to give them a medical savings account, the only choice patients have is to purchase health insurance. And so it puts them right back in, when you're purchasing health insurance on an individual basis, it's more expensive than if you're having part of a large pool. When you have to, only way that you get a cheaper price is when you agree to have a greater deductible or greater out-of-pocket expenses, and you have fewer choices. So they didn't save any money, and giving the money to the patients doesn't help the patients make better decisions.
Okay, and we heard a lot of discussion about coverage more affordable for small businesses and employers. I think what is important to acknowledge is that nearly half of the adults within the ACA marketplace are small business owners or employees or self-employed, and letting these tax cuts expire is going to hurt them dramatically. And Mr. Chairman, before my time is up, I do want to note that tomorrow, CDC's vaccine committee is meeting to discuss the childhood vaccine schedule and the hepatitis B vaccines, something the chair of this committee has said many times saves lives. The CDC Advisory Committee is going to hear from who knows who, but based on the fact that the CDC's own website now spreads anti-vax disinformation, I want to state for the record, I am deeply alarmed this committee has not done more oversight, and we still have not done a thing to force RFK Jr. to come here and answer questions about his decision to fire the CDC Director, Menares, and limit access to life-saving changes. And Mr. Chairman, I hope that will change.